So, as could probably be expected, higher mortality from penetrating trauma, gunshot wounds, stab wounds, etc. Usually, you don't get as many of those with elderly, but I'm guessing it can happen. Well, I know it can happen. So, as far as injuries go, though, older adults, elderly people, falls. Right, falls are the bigger thing. So falls not in only in addition to just general trauma, but head trauma, obviously from falls. But obviously the number one traumatic cause of issues. All right, doesn't want to. There we go. All right, anatomic changes and trauma. Right, they weaken bones. Right, the bones aren't as protective. There's not as much muscle mass. Right, and so less protection, and the body doesn't compensate as well, which we've kind of talked about. Osteoporosis, more likely for fractures, right? Hip and pelvic fractures. So we do get more of those. That's the I won't say joke, but always kind of the smart aleck. Oh, you'll break a hip. Don't be careful. You break a hip. Elderly people do break hips at a much greater rate than younger adults. Okay, and also compression fractures of spines, which is an impact thing, not so much a twisting, shearing force like you get with younger patients. Brain tissue, right? We've talked about that. That means the brain can slosh around more, right? So that head injury can be much more devastating, much more dangerous for an older elderly person than it would be for younger. Okay. Environmental injury, obviously heat injuries and cold injuries are going to be faster. The body doesn't regulate temperature as well. So hypothermia does set in faster and affect more. So it is a bigger factor. Okay. When you're dealing with trauma in an elderly patient, you always consider it to be multi-system trauma. The likelihood of more injuries than just one isolated break or bruise or anything like that is obviously much greater. Seeing size up. Look for clues that indicate your patient's traumatic incident may have been preceded by a medical incident. Right? Could they have had a stroke? Could they have seizure, fainted, whatever before they fell? Right? So look for that. Any indications that might be there. Trauma patients, right to a trauma center, right? Because it is worse. Use Avapalene Glasgow coma scale like always. Airway, breathing, circulation. Nothing new there. Just look for dentures, right? Look for broken teeth dentures. So circulation, older patients, shock is more of an issue. It happens faster and more severe. So be aware of that. History taking. Okay. Yeah. Nothing new here. Physical exam. Right. Again, nothing new here. It's trauma, right? If it's focused, do focused. If it's head to toe, do head to toe. But just realize that head to toe is more likely, with that multi-system with elderly. Vitals, exactly the same as the last one. Remember, they are more likely to decompensate with shock. Shock hits them harder. Okay, so splint, broken bones, right? Don't force it in if you can try to ease it into normal position, but don't force it. That's always. Avoid log rolling and hip and pelvic fractures. Use the scoop stretcher. Right? Whenever possible, use the scoop stretcher. But if you have to log roll, you want to be very good about keeping that leg in place. Have somebody working on that. Prevent hypothermia. Keep them warm. Right? Falls. What caused the fall? Try to find out if you can. Right? Not always possible, but try to find out if you can. Try to piece things together. That's good information to bring into the ER. Okay, even at a good nursing home, people fall. My grandmother she's just been in the nursing home for a week now, and she still tries to get from the bed to her chair or from the chair to the bathroom by herself without calling for help. And she has not necessarily fallen, but slid to the floor probably 3 times now. Because they can't supervise them all one-on-one. So they do happen, even at good places. So remember that. But ask the staff, is everything normal? Is anything new? Is this normal for her, right? How often does she fall, right? What's the mental status? Is that normal? So very, very common question with dealing with elderly people. Is this common? Is this normal? Infection control, right? MRSA is a thing. It resists standard antibacterial medications. So infection control is always a high priority, and we need to make it part of our own priority. Um, Patients that choose to die at home. Palliative care, hospice is a common term for that, right? Hospice, they choose hospice care. Hospice will come in and help take care of their medications and keep them comfortable, and so know that it's happening more and more, where they choose to just stay at home and let it go. So determine family wishes, determine patient wishes. On that note, we have advanced directives we have to follow, which are legal papers that elderly people sign when they're of sound mind and body, that dictate what's to happen when they can't take care of themselves anymore. Okay. Particular kind of be a DNR or a DNI. We hear DNR and DNI together. Do not resuscitate, do not intubate. They go hand in hand. So if they are in cardiac arrest, you just let them go. Can be hard for some family members, right? It doesn't mean if they're we don't just let them lay there, right? If they're in cardiac arrest, we do not resuscitate, but above and beyond that, we do care for the patient, right? We help them breathe if they need it, right? We stop at the point where CPR would start or intubation would start is where we stop. Okay, we still work up to that point. Elder abuse and neglect, we can have the same principle as with pediatric. The only difference is property, right? They can be physically abusive, they can be emotionally abusive, but with elders, a lot of times they'll steal their money, right? Vulnerable adults, they've also got property to take. That's kind of the difference that you deal with from pediatric, right? There's also money and property at stake. Victims oftentimes feel embarrassed and don't want to come forward, right? And so and a lot of times it might be family members, and I don't want them to get in trouble. So there's some other stuff involved with elder abuse and neglect that you have to deal with. We're still obligated reporters, which means we still have to report abuse even if it's there. Usually it's older women. It's just a fact. Oftentimes it's people that enter the situation, posing as people that are going to help, caregivers. Okay, sometimes it's kids, their own children or grandchildren. Sometimes it's nursing care centers. So it does happen. So keep your eyes out for that if you do see it. Yeah. If the patient or the family member don't want to give you answers to things, or answers that don't make sense, timelines, kind of like the child abuse thing. The timeline of injury doesn't make sense. The mechanism based on what you see doesn't make sense. It can still be abuse there too. Okay. Caregiver doesn't care, right? You come in, you show up, and they're fine. They're fine. Or they don't. I don't. Whatever. Do whatever. Take them. Whatever. Just be aware of that. Okay. So you can read through some of these, but they're all kind of apparent answers or signs of, well, something's just not right here, and that's kind of always what we're looking out for, right? Okay, depends what you're called for too, right? There are certain things you might be called for that might affect what you're thinking here, right? So, pain seeking or medication seeking, not pain seeking. Medication seeking, there's pain, but there's no explanation. They're not eating or sleeping, they're depressed, right? So, categories of abuse, there you can read through those: the physical, psychological, and financial. Remember, that's kind of the same principles as child abuse, other than you get to the bottom with the financial stuff. Right, bruises. A lot of this is exactly the same as the child abuse stuff. Okay, bruises, pinch marks, slap marks, right, bite marks, burn marks. A lot of that stuff can be there. Okay, lack of hygiene. I hate to say it might be normal, or it might be. It depends. If somebody's living by themselves, and there's a lack of hygiene, that's one thing. If they're living and there's supposed to be a caregiver there, that's obviously a troubling sign. So just be aware of the differences between someone living alone and somebody that should have somebody caring for those, and what should be going on. Right? They should have a blanket. They should be nice and warm. They shouldn't be, if they're living by themselves. There's going to be problems they face that they shouldn't be facing when they have a caregiver. Um, any issues, any injury, whatever, to the genitals or rectal region, right, is a sure sign of abuse in whether it's elderly, children, or any adult. Okay, just know that. All right, we'll come over this later. This is all we got today. So what I want you to do, you're done watching this. I want you just to write down, I don't know, write down a handful of signs of abuse, child abuse, and or elder abuse. What are some things to be looking out for in cases of abuse? So I'll put up a Dropbox for that, and we'll talk to you tomorrow.